Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm speaking with Adam Stansell, the co-founder and chief operating officer at Telehealth. How are you today?
Doing all right. Thanks for having me.
I'm excited to chat. You're in a very interesting space within healthcare, and I think we should dive right into it out of the gate. I'd love if you could tell the audience about your background, and we will go from there.
Cool. Yeah. So out of college, started off working in consulting, did some healthcare work, but also retail, consumer, sort of running the whole kind of spectrum. After that, I spent a couple of years at Uber, launched Uber Eats in a number of markets, spent a lot of time working through kind of earlier stage incubation type work with them, but really all focused on sort of this, offline, online type model, figuring out how you get things around a city efficiently, how you make sure, all sides of the marketplace are well balanced. After that, I spent some time working at a fleet management and telematics company called Keep Truckin', building out new businesses for them. And then last year, founded Telehealth along with my co-founder, Connor Haley. Here we are.
I gotta tell you, I love the name, love the logo, brand color. That's the first thing that always stands out to me is what does the brand look like? And you passed all the tests there. Love the colors, love the logo you decided on. Can you tell us? What were you going to say?
I was going to say, I don't want to tell you how much time we spent actually picking between different logo options. So I'm glad it worked out. I'm glad we chose correctly.
Time well spent. Spent.
Good to hear.
That being said, I'd like to transition into, if you could, you kind of gave us a good quick intro into your career. Can you talk us through the three things I really like to focus on, the why, how, what of Telehealth, and then we'll talk about some of the other questions that I have for you.
Yeah. So the why, to be honest, I feel like the why question in healthcare has sort of become irrelevant at this point. I think everybody knows how broken our healthcare system is. Everybody's seen all kinds of different problems. The question is really more a matter of why this particular angle on solving the problem than, why healthcare, why the business in general. For us, coming out of the pandemic, we obviously saw an explosion of telehealth, right? You see somewhere, I think the jump was, 8% roughly of patients before COVID had telehealth visit up to like closer to 80% now. And that's amazing, right? That's sort of a change that needed to happen. It's been, a long time coming. But there are these huge gaps. And so you see all these different situations where, patients need, really the biggest difference is physical interactions. And they need, even like a basic checkup, blood draws, injections, all these different things that they can't happen over video. And so that's where we came in, right? We saw this explosion in telehealth, decided, hey, this is part of the solution, but it's not all of the solution. And how can we build this sort of complementary piece of the puzzle that'll enable telehealth to really drive the future of healthcare, but in a way that still maintains the best pieces of the current in-clinic model.
Yeah, it's when people think of what the future of healthcare, like how it's going to continue to evolve, the piece of home care just keeps growing, right? People want to be in the home when getting care, especially at an older age. Right. They would much rather be, even as far as someone that's in hospice, right? They would much rather be at home with their loved ones in a much more comfortable environment than not knocking any of the health systems or, it's just better to be at home, right? It's where you feel most comfortable.
It is.
Can you talk to me a little bit about why you feel home care is so important through your lens?
Yeah. You said it, it's the future. There's number of reasons why it makes sense. The first and the most important, I think, is that you get better clinical outcomes at home than you do sending people to a hospital. We've seen time and time again with these studies that are testing out, the hospital home model, as well as sort of the gap in kind of uptake of preventative services when they're offered in home versus need to happen in a clinic. You just get better clinical outcomes. So it's better for patients in the long term as far as their health. It's better for them in the short term because it's more convenient. And it's better for the entire healthcare system because you're not end up spending all this money solving problems that you could have kind of nipped in the bud early on. I think about kind of the transition towards value-based care, which, long time coming again, right? One of these things that should have been happening a long time ago. But that's really going to be centered around preventative care, right? And helping people be healthy sort of over the long term. The most important piece of that is going to be accessibility and convenience, right? People don't get their basic checkups every year now. Even though everyone knows they should, because it's inconvenient. You don't want to take the time. When you start introducing an in-home model where you can have these things happening in a really convenient way where it just kind of slots right into a patient's schedule, you see a huge uptake in the actual preventative care, right? You're talking about like a 50% increase in administration of flu vaccines when they happen in-home versus in a clinic, right? There's all these different ways in which we've seen preventive care is more likely to happen when it's more convenient. And so if you think about driving health outcomes as opposed to health services, it has to start by making it more convenient.
Thank you for sharing that. Yeah, it'll be interesting to see how it continues to evolve, and it'll be interesting to see how companies like Axle Health continue to help that side of the healthcare space continue to grow. Can you talk me through a little bit about how Axle Health, across telehealth, what is Axle Health's role in scaling telehealth?
Yeah. So, our product is actually composed of kind of three different pieces. So we've got a network of healthcare professionals around the country, right? And that's sort of step one of making sure that every patient can be seen in home when they need to be. We've then got the software platform to sort of coordinate all of that work, right? And that's obviously a major undertaking, coordinating this nationally, dealing with, corporate practice of medicine restrictions, licensure verification, all these different things that need to happen to make sure that, everybody's kind of dotting their I's, crossing their T's. And then we actually have a live operational monitoring team that's sort of doing all of the, real-time monitoring, but then also the logistics of, shipping test tubes around the country, right? Doing all these things that need to happen in order to make this all happen in sort of real time. And so our product is really focused on delivering an end-to-end solution that any company can plug into to be able to deliver these services in home. For telehealth, what that means is that you now have these telehealth providers that can expand their offering from just being this sort of really kind of transactional video conversation, right? Where you can't really maintain continuity of care over video just because there's so much that needs to happen in person. We are a white labeled solution that allows any telehealth company to then offer these physical services, super high quality, really kind of state of the art technology, everything else, but making sure that it's under the telehealth company's brand so they can maintain that continuity of care. And that makes them full service providers, right? We've seen this explosion of, virtual primary care. Virtual primary care doesn't work if you're still going into a Quest to get your blood drawn. Then you're just, sort of a video doctor in a Quest, and that's not the future. And so we see the future as being this really end-to-end solution where the physician is owning the patient relationship, and we basically handle all of sort of the nitty-gritty of getting those physical services done in home.
I really like the focus that you chose and how you're continuing to scale the company. That being said, one of the things that helps scale the company, right, is you recently announced the round of funding. I think it was back in May, right? Can you talk us through, you closed that round of funding. What's next? What's next for Axle Health?
Yeah. So, hiring is a big piece. If you like what we're doing, you're interested in joining us, please do reach out. We're always happy to talk to people that are passionate about the space. And then really making sure that we can build a product that serves the needs of all of our different customers. We started off looking at telehealth as it was really the genesis, right? I mean, the idea came out of this sort of movement towards telehealth and kind of filling this gap between virtual care and the actual physical world. But we've found across the board, people are interested in this product, right? Health systems, they want to move towards this hospital at home model. Payers starting to offer more direct services. That clinical research, right? We've got this decentralized clinical trial model that it's amazing. I mean, it really is sort of head and shoulders above kind of the previous models. And so there's all these different types of companies that want something like our product. And that's hard to build, right? And I mean, there's a reason it doesn't already exist. There's difficulties there. And so our goal is going to be building out, the tech, building out the operation side of things, and then just, connecting with as many players in the space as possible to make sure we're really tuning the value prop for everybody that wants to use the product.
Well, I'm really excited to see what happens next and to see your continued growth. And definitely, if anyone's interested, be sure to connect with you. I'm going to tag you in the post, so they'll be able to, send you a message on LinkedIn or add you there if they want to chat. Where can people learn more about Axle Health?
Yeah. So, our website, axlehealth.com. We're always happy to connect with people and discuss kind of more in detail. So feel free, our emails on the website, just info@axlehealth.com, and that's monitored 7 days a week. We'll get back to you within a day or so. But also, feel free to reach out to me on LinkedIn. My door is always open, and really, just excited to kind of meet more people in the space that are really moving the needle, right? This is a massive industry that's got a lot of issues, to be totally frank. And anybody that's working to solve some of those issues, my door is always open.
Love it. Yeah. And I'll throw in the show notes links to your social media pages, so we'll be able to check you out there directly. But hopefully we can have you on again very soon. It was great to learn more about Axle Health, kind of hear about some of the progress so far, what's next for the company, and also your thoughts on a few key questions I really was interested in hearing your answers for. So thank you for giving me those. Thanks so much for being a guest.
Yeah, my pleasure.